Okay, so let's jump right in. Today we're doing a deep dive into something that affects so many of us. Diabetes blood testing. And we're looking at sources from the Blood Test UK website. Our goal is to unpack what these tests are, but more importantly, why getting tested early, right, in your own community, places like Chelmsford is such a huge advantage for your long-term health.
Right. And if we look at the bigger picture, it's really all about getting information you can act on.
Exactly.
So we're going to quickly break down the different tests and, focus on why getting them done regularly at a local clinic is probably the best thing you can do to stay healthy.
So to start, let's talk about the main types of tests that Blood Test UK highlights for checking your blood sugar. They each tell a slightly different story, right?
They do.
The first one, and it's kind of the big one for long-term management, is the HbA1c test.
What's really fascinating about the HbA1c is how it works. It's not just a snapshot. It shows how much sugar has basically stuck to your red blood cells over time.
Over the last couple of months, right?
Exactly, about 2 to 3 months. So it gives this really reliable long-term picture of your average sugar levels. It's the gold standard because it tracks that constant exposure to high glucose.
Okay, so if the HbA1c is the long view, what about the fasting plasma glucose test, the FPG? I mean, is it still as important with all this new tech coming out?
It absolutely is. The FPG is still critical for that initial diagnosis. It gives you a baseline, a snapshot of your sugar level first thing in the morning after you've fasted.
And fasting is key here.
Oh, it's essential. This is a really important point the sources make. You have to fast for about 8 hours, and you can only drink water, not even coffee.
Wow, okay.
Any little thing can throw the result off, which is why following the rules is so important for an accurate reading.
And I guess that limitation is what makes the third type of test so interesting, the continuous glucose monitor, or CGM.
The CGM is a complete game changer. It's that little device you might see people wearing, and it tracks your sugar levels all day, every day, real-time data.
So you can see the spikes.
You see everything, the spikes, the dips. You see exactly how that meal you just ate is affecting you right now. You just don't get that from the other tests.
Which brings us to a really interesting point from the Blood Test UK sources. It's great to have all this data, but how do you make it easy to get? And that's where local testing, like in Chelmsford, comes in.
Yes, this is a huge benefit. Local clinics aren't just about convenience. They offer care that's tailored to the community.
Less travel time, easier to get an appointment.
And that makes people much more likely to actually go and get tested regularly. When it's easy, people do it.
And doing it regularly is what leads to early detection. Finding prediabetes early means you can make lifestyle changes right away. You might even be able to reverse it.
And the research backs this up so strongly. There's a study mentioned in the source material that is it's incredible. It showed that patients who did regular HbA1c testing saw a 30% reduction.
32%.
A 30% reduction in serious complications. Think about what that means. Preventing things like nerve damage or vision loss. The test results let you and your doctor make immediate changes to diet or medication, stopping the disease before it causes real damage.
So really what this all boils down to is that these simple tests, especially when they're easy to get to locally, are probably the most powerful tool you have for your long-term health.
Absolutely. It's about empowerment.
So you can turn a health risk into something you can actually manage.
So I'll leave you with this final thought, and it's about that continuous monitoring. Think about what it means to have that real-time data from a CGM. It lets you see right there in the moment how that jacket potato or your favorite dessert is actually changing your blood sugar.
That's immediate feedback.
It is. It's not a theory anymore. It's your own body telling you what works and what doesn't. That kind of insight really puts you in the driver's seat of your own health.